This channel serves to educate and inform, yet it doesn't replace expert medical counsel. Remember, your medical queries and concerns should always be directed to a professional. Diagnosis, treatment, or any health-related advice? Seek the wisdom of your physician or a qualified health provider. Let this be a springboard for learning, not a substitute for professional guidance. Dive in, absorb, but always consult with the experts for your health matters.
Have you ever pondered why some pregnancies don't make it to the finish line? Today, we delve into the unspoken truth about miscarriage. Miscarriage, an event that is more common than we'd like to admit, is often shrouded in silence and mystery. It's the unexpected ending of a pregnancy before the 20th week of gestation, a reality faced by many couples worldwide. This is a topic we often tiptoe around, avoiding the uncomfortable truth, but today, we confront it head-on. We aim to clear the air, to demystify, and to shed light on an event that touches the lives of many, yet remains unspoken in our everyday conversations. In the vast world of human reproduction, miscarriage is a common occurrence. It's not an anomaly or a rare event, but what exactly is a miscarriage? A miscarriage is when a pregnancy ends on its own within the first 20 weeks. It's a natural event that often happens because the fetus isn't developing normally. This is usually due to chromosomal abnormalities that prevent the fetus from developing further. This definition, however, is just the tip of the iceberg. The full picture of miscarriage is much more nuanced, influenced by a myriad of factors and conditions. It's a complex issue that weaves together the threads of genetics, health conditions, age, and much more. As we navigate through this topic, we must remember that it's not a subject to be shrouded in silence or treated as taboo. Instead, it's a reality that many couples face, a part of the human experience that deserves our understanding and compassion. As we proceed, remember that miscarriage is not a taboo subject, but a reality for many couples worldwide. So, what causes a miscarriage? The answer might surprise you. The primary cause of miscarriage, particularly in the early stages of pregnancy, is typically chromosomal abnormalities. This doesn't mean there's something wrong with the parent's genes, quite the contrary. These abnormalities usually occur by chance as the embryo divides and grows. However, it's important to note that these abnormalities can sometimes be the result of an egg or sperm's poor quality, which can be influenced by the parent's age or health. But chromosomal abnormalities aren't the only culprits. A range of other factors can also contribute to a miscarriage. Hormonal issues, for instance, can play a significant role. Conditions like uncontrolled diabetes, problems with the thyroid or adrenal glands, and polycystic ovary syndrome can all increase the risk of miscarriage. In some cases, hormonal treatments can help manage these risks. Infections can also lead to miscarriage. Certain bacterial and viral infections can be harmful to a developing fetus and result in a miscarriage. These could include some sexually transmitted diseases, urinary tract infections, and certain diseases like rubella and malaria. Moreover, the mother's overall health can significantly impact the pregnancy. Conditions like high blood pressure, kidney disease, autoimmune disorders, and malnutrition can all increase the chances of a miscarriage. Even lifestyle choices like smoking, drug use, and excessive alcohol consumption can have an impact. Lastly, structural problems with the uterus or cervix can also lead to a miscarriage. These could include weak or short cervix, fibroids, or abnormal shape of the uterus. In the grand scheme of things, a miscarriage is often a natural event that can't always be prevented. It's a sign that something wasn't right with the pregnancy, and nature is taking its course. But understanding the potential causes can help us better manage the risks and ensure a healthy environment for a developing baby. Understanding the causes of miscarriage is the first step in demystifying this often misunderstood event. What are the signs of a miscarriage, and who is at risk? Just like a storm, a miscarriage also has telltale signs. The most common symptoms are cramping and bleeding. Picture a heavy period, but with more severe cramps. This isn't a light tap on the shoulder kind of discomfort, but rather a wrenching pain that can be hard to ignore. However, it's important to remember that not all cramping and bleeding during pregnancy signifies a miscarriage. It's crucial to reach out to a healthcare professional if you experience these symptoms, to ensure both your safety and that of your baby. Bleeding, on the other hand, can range from light spotting to heavy bleeding similar to a menstrual period. The color may be brown or bright red, and it may come and go over several days. In some cases, the bleeding may be accompanied by passage of tissue or clot-like material. Now, let's talk about risks. Who's more likely to have a miscarriage? The answer might surprise you. Miscarriage is an equal opportunity event. It can happen to anyone. However, certain factors can increase the risk. One such factor is advanced maternal age. As a woman's age increases, particularly after the age of 35, so does the risk of miscarriage. This is due to a higher likelihood of chromosomal abnormalities in the eggs. Certain health conditions can also increase the risk. These include hormonal issues, infections, and chronic diseases like diabetes or high blood pressure. Women with a history of 3 or more prior miscarriages are also at an increased risk. Lifestyle factors such as smoking, drinking alcohol, and using drugs can also contribute to the risk. It's important to lead a healthy lifestyle not just for you but for your baby as well. Recognizing the symptoms and understanding the risks can help us navigate the challenging path of miscarriage. When a miscarriage occurs, what happens next? This is a question that many people grapple with. Understanding the treatment options available can provide some clarity during a difficult time. The course of treatment after a miscarriage often depends on the specifics of the situation. The most common management options can range from expectant management to surgical procedures. Expectant management is essentially a watch-and-wait approach. This allows the body to naturally pass the pregnancy tissue. It's a suitable option for those who prefer not to undergo any medical or surgical treatments. However, it can take a few weeks and may cause heavy bleeding or pain. Medical management involves taking medication to stimulate the body to expel the pregnancy tissue. This method may be chosen if the miscarriage hasn't completed naturally, or if there's a risk of complications. It's a relatively quick process, usually taking place within a day or two, but it can cause side effects such as nausea or diarrhea. Surgical management involves a procedure called a dilation and curettage, or D&C. This procedure is performed under anesthesia, where the cervix is dilated and the pregnancy tissue is removed. This option is often chosen when the miscarriage is incomplete or there's heavy bleeding. It's typically a quick process and recovery time is usually short. All these methods have their pros and cons, and the choice often depends on the individual's health, personal preferences, and the specifics of the miscarriage. It's crucial to discuss these options with a healthcare provider to determine the most appropriate course of action. After treatment, spotting and mild discomfort are common, and it's essential to give the body time to heal. Follow-up tests may be recommended, particularly after multiple miscarriages, to explore any underlying issues. The aftermath of a miscarriage can be physically and emotionally challenging, but appropriate treatment can help the healing process. Remember, it's important to take care of both physical and emotional health during this time. Reach out to support networks, consider counseling, and always communicate with healthcare providers about concerns or questions. Is it possible to prevent a miscarriage? This is a question that often weighs heavily on the minds of many. The answer is not clear-cut, but there are certain strategies that can potentially help. One such strategy involves genetic testing. By evaluating the genetic material of both parents, doctors can identify potential chromosomal abnormalities that could lead to a miscarriage. This information can be invaluable, particularly for couples who have experienced recurrent miscarriages. Another strategy is evaluating the uterus for abnormalities. Issues like fibroids or an abnormally shaped uterus can contribute to miscarriages. If detected, these conditions can often be treated, thereby reducing the risk of miscarriage. It's important to remember that these strategies do not guarantee prevention, but they can certainly help manage the risk factors. Regular prenatal care, maintaining a healthy lifestyle, and avoiding known risk factors can also play a pivotal role in preventing a miscarriage. While not all miscarriages can be prevented, understanding potential prevention strategies can provide a glimmer of hope. As we wrap up, let's revisit the key points in our discussion. Miscarriage, an unexpected end to a pregnancy before 20 weeks gestation, often stems from chromosomal abnormalities. Its symptoms, including cramping and bleeding, can be distressing, but it's important to remember that you're not alone. Risk factors can range from advanced maternal age to certain health conditions, but it's crucial to remember that a miscarriage is not anyone's fault. Diagnosis typically involves ultrasound and blood tests, and there are various management options available, from expectant management to surgical procedures. In terms of prevention, strategies may include genetic testing and evaluating the uterus for abnormalities. Yet it's important to understand that not all miscarriages can be prevented. Every situation is unique and requires a tailored approach. Remember, miscarriage is not a solitary journey. There is help, there is understanding, and most importantly, there is hope.